Hello everyone, I am back again with a new video on my channel, The Courageous Nurses. I hope you will learn in an effective way from my video. So let's start without wasting much time. So as you can see on this video, we will talk about the retinal detachment. Coming to the introduction. Coming to the introduction, as you can see, I have already provided you with the content, so you can understand what I'm trying to tell you. As you can see in my previous videos, I was not able to write on the slide. So because of that, I have given you the content. So whatever I'm saying, you understand it in an effective way. So you see here it is written that retinal detachment, it is a separation of the sensory retina and the underlying pigment epithelium with fluid accumulation between the two layers. So what are the two layers? That is the retina and the choroid. Because of the various reasons which we will see later on, there will be accumulation of fluid between the two layers. Now if I will talk about the incidence in the non-traumatic retinal detachment, out of every 10,000 individuals each year, at least one of them will suffer from the non-traumatic retinal detachment. And if I will include the aphakic individuals, here as it is written over here, the aphakic individuals, what does we understand by aphakic? It means the people who do not have lens in their eyes. These people are called the aphakic individuals. People without lens in their eyes, aphakic individuals. So if we will include them, the rate will increase much more. And if I will include the traumatic retinal detachment, then the rate will increase a little higher. Slightly it will be increased. In the patient with no other risk factor who has had a retinal detachment in one eye, the risk of detachment in the second eye is at least 2 to 25%. And almost all patients with an untreated, so people who are symptomatic and they have not treated themselves, so eventually they will become blind. Now coming to the definition, here it is written, retinal detachment describes an emergency situation in which a thin layer of tissue, the retina at the back of the eye, pulls away from its normal position. Because of the detachment, the retina where it should be, it has come to some other position rather than being into its normal position. So what will happen? Because retina, it has got detached from its retinal cells, the blood vessels. So what will happen? It will not get proper oxygen and nourishment. The proper oxygen and nourishment the retina gets from the blood vessels, it will not get. Okay, so eventually what will happen? Blindness will be there, necrosis can be there. Okay, so moving ahead. Now coming to the types of retinal detachment, it is very much important to understand these three. Why? Because they consist of different pathophysiology, right? So here we can see there are mainly three types of retinal detachments. What are they? That is your rhegmatogenous detachment, fractional retinal detachment, and exudative retinal detachment. This exudative retinal detachment can also be said as serous retinal detachment. Exudative or serous retinal detachment. So we will see it one by one. So this is the first type, that is your rhegmatogenous detachment. Look, I just want you to have a better understanding of the types of retinal detachment, because because three of them, they have got their own pathophysiology. As you can see, the word it is given over here, rhegmatogenous detachment. Here this rhegma word, it comes from Greek word that means to rent. So what will happen? Because of the hole or tear which has been developed because of the various reasons, various disease condition, so what will happen? The liquid vitreous, it will come inside between your retina and choroid, and which will lead to further tear and further accumulation of the fluid, which will lead to the detachment of your retina. This type of detachment, where there is a hole, there is a tear, and the vitreous fluid has gone inside, this type is called your rhegmatogenous detachment. So if it has got detached, what will happen? Because as you can see, it is written over here, RPE. What is RPE? The RPE is your retinal pigment epithelium. It is the cells which is tightly joined to their neighbors. What will happen? It produces a barrier between the retina and choroid. So because it is producing the barrier, so that there will be proper circulation of oxygen and nutrients to the retina as well as choroid, because there is proper distribution, there is a barrier, so there is no leakage in between. Okay, but it has got detached, so because of which what will happen, there will not be proper oxygen and nutrients which the retina will get. Okay, this is your rhegmatogenous detachment. Now because of what this is happening, there are various reasons, like it mainly occurs in myopia, lattice degeneration, horseshoe tears, round retinal holes. Now coming to other causes like your necrotizing retinitis, like toxoplasmosis, cytomegalovirus infection, acute retinal necrosis syndrome, all of which increase the chance of developing full thickness retinal tears. Okay, now moving to the second type. Here you can see tractional retinal detachment. Tractional we can understand. When we hear the word tractional, it means something pulling, something forceful has been pulled, or because of some penetrating effect, the retinal detachment has occurred. So with the word we can understand what it can be. So now what can be the various reasons because of which tractional retinal detachment has occurred? So most common cases are like in case of proliferative retinal and vitreoretinal diseases like proliferative diabetic retinopathy, sickle cell retinopathy, retinopathy of prematurity, following penetrating trauma, which I have already told you. So because of these various reasons, tractional retinal detachment can occur. Now coming to the next one, exudative retinal detachment, or we can also say serous retinal detachment, right? It occurs as a result of production of serous, and because of which it is also known as serous retinal detachment. Serous fluid under the retina from the choroid. Conditions such as uveitis and macular degeneration may cause the production of this serous fluid. So this fluid, it can come from choroid as well as retina, or at times from both of them. So because the blood vessels who are producing the fluid, the various fluid from retina and choroid, they will lead to the production of serous. And yes, because it is called an exudative, serous, which is not a clear liquid, it means something infective fluid has been accumulated. That means there will be some infection, right? So because of this infection, there will be production of your serous fluid. Now there are mainly two reasons because of which there will be accumulation. One is your inflammatory disease, because of inflammatory diseases, and another is your vascular diseases. So when I talk about the inflammatory diseases, like it includes your posterior scleritis, sympathetic ophthalmia, Harada disease, pars planitis, collagen vascular disease. And if I talk about the vascular disease, it includes your malignant hypertension, toxemia of pregnancy, your Coats disease, etc. So these are the various reasons because of which we can see the exudative retinal detachment. I hope three of them it is clear to you. So when we talk about the etiology, the various reasons of retinal detachment, it is first one is your retinal break. As you can see, retinal breaks are there, interruption in the full thickness of retinal tissue, and they can be classified as tears and holes. Retinal holes are atrophic retinal breaks that occur spontaneously. And retinal tears can occur as the vitreous humor shrinks during aging and pulls on the retina. The retina tears when the traction force exceeds the strength of the retina. So when the retina it has loses its strength, that time the tear will occur. Coming to aging is the most common cause of rhegmatogenous retinal detachment. Why? Because as you get older, the vitreous in the eye may change in texture and may shrink. Sometimes as it shrinks, the vitreous can pull on the retina and tear it. Other things that can increase risk of rhegmatogenous retinal detachments are eye injuries, eye surgery, and nearsightedness. That is your myopia. The common cause of retractional retinal detachment is diabetic retinopathy, an eye condition in people with diabetes. So people who have diabetes, they get this diabetic retinopathy. Diabetic retinopathy, it damages the blood vessels in the retina and can scar your retina. We already know, because in diabetes what will happen? It affects all organs. It affects your kidneys, it affects your eye, it affects your food, everything it will affect in diabetes. So as the patient is having is more diabetic, so this retina is also affected. As the scar gets bigger, they can pull on your retina and detach it from the back of your eye. Other causes of tractional retinal detachment include your eye diseases, eye infection, and swelling in the eyes, which I have already told you. The most common causes of exudative retinal detachments are leaking blood vessels or swelling in the back of the eye. There are several things that can cause leaking blood vessels, swelling in your eye, injury or trauma to your eye, age-related macular degeneration, tumors in your eye, diseases that cause inflammation inside the eye, Coats disease, a rare eye disease. Okay. Now coming to the clinical manifestation, it is said photopsia, that is your light flashes, floaters. So if we talk about floaters, if this is your peripheral vision, it won't be clear. It won't be clear. So what will happen? There will be like this: something is floating. The image won't be clear to you. Now coming to the cobweb, hairnet, or ring in the field of vision, it will be like your hairnet. Something, something like this will be there, a forming of like the spiders, the way they make a net, so something like that it will be there. Then coming to painless loss of peripheral or central vision, this is a main characteristic of your retinal detachment, a curtain coming across the field of vision. What will happen if this is a field of vision? A curtain like this will try to come. Okay, the way so see, a curtain is coming, it can be like anything. Okay, so like curtain, it is coming. Then coming to, if the detachment is in the superior nasal retina, the visual field loss will be in the inferior temporal area. If the detachment is small or develops slowly in the periphery, the patient may not be aware of visual problem. Okay, so if it is very much small and it is in in the peripheral means in the side, so the person might not be aware of the disease condition. Now we will see the diagnostic evaluation, history and physical examination. In history, we have to take proper history of the patient. If there was any kind of surgery, if the patient has got any diabetes or any FAQ cases, physical examination we will do. Mainly we will do for the eyes. We will see the bilateral, whether it is bilateral or not, if it is FAQ or not, whether the person is having any eye prosthesis or not, everything we will see. Then with the help of ophthalmoscopy, slit lamp microscopy, with these we will identify the retinal condition. And there is also another thing, that is your ultrasonography of your eye, through which we can identify the retinal detachment. Now coming to the surgical management, because if the person is having retinal detachment, surgical management is very much important. So we will see it one by one. Scleral buccal pneumatic retinopexy, pars plana vitrectomy, transconjunctival sutureless vitrectomy. So see, I have provided you with a picture so you understand the concept very clearly. Here you can see there is a silicone band. Okay, or scleral band, you can see a transparent. So what it has done, it has compressed the sclera. It can be also said as silicone band or scleral buccal. So it has compressed your sclera. Okay, so surgeon, what will they do? They will produce this silicone band. What will happen? Because of which there will be compression and it will also cause less damage. So the complication which we can see is your myopia or diplopia. Diplopia is your double vision. Now coming to the next picture. This is your pneumatic retinopexy. Okay, it repairs your rhegmatogenous retinal detachment. It is very much less invasive, and as you can see, a bubble. This is a gas bubble, or we can also say a silicone oil or perfluorocarbon, and liquid may be injected into vitreous cavity to help push the sensory retina up. Okay, so what it has done, it has pulled it up the retina. Now coming to the pars plana vitrectomy, here we can see that vitrectomy has been used. This is an advanced procedure where surgeon has made a very minute incision, at least 1 to 4 millimeter of incision has been made in two sides. From one side there is a portal for the light source and another side vitrectomy is there. So what the surgeon has done, the surgeon dissects the pre-retinal membrane. There will be pre-retinal membrane will be dissected under direct visualization, and which what will happen, the retina will be stabilized by an intraoperative vitreous substitute. Okay, it will be your stabilization will be there. Now coming to the next picture, here you can see this picture I have provided for the people who do not know about the pars plana, because most of the time we miss this thing, pars plana. So people who knows, it's very good, and the people who doesn't know, you can see there is a start of retina, and this is your ciliary body, but this place where there is something, which is empty, this place is called your pars plana. From here the vitrectomy will be inserted. Now coming to the transconjunctival sutureless vitrectomy. This is another advanced type of vitrectomy. What it will do, it will provide a less invasive procedure, because it will go from your conjunctiva, because it is going from the conjunctiva, so there will be less it will be less invasive, and vitrectomy will be used again, so there won't be any suture, so it will be your sutureless. Okay, so and it is also said that earlier we were using 20 gauge of needle, right, 20 gauge of, which is much more bigger, but in this transconjunctival sutureless vitrectomy we are using 25 gauge of 25 gauge of transconjunctival sutureless vitrectomy. Okay, so as a result, the post-operative inflammation, it has been decreased. The promotion of your rapid wound healing and patient recovery is much faster in your transconjunctival sutureless vitrectomy. Now coming to the nursing management, here you can see, because the person has gone for the surgical management, surgical procedure, so you can see acute pain related to surgical procedure as evidenced by verbalization, discomfortable, disturbed sensory perception related to altered status of sense organ as evidenced by reduced vision, loss of vision, risk for injury related to visual disturbances as evidenced by difficulty is recognizing objects nearby, unable to see properly. So you can just write the nursing care plan, and you can write it much more than this, but the important things I have mentioned over here. Now coming to the complication diplopia, which I have already told you, it is a double vision glaucoma. There will be increase of your intraocular pressure in your eyes. There will accumulation of the fluid, okay, because of which there will be increase in intraocular pressure more than 20 millimeter of mercury. Bleeding can be there, hemorrhage can be there, internal of your eyes, blurred vision can be there. So these are the various complications which we see. I hope you like the video. Do share and subscribe for more videos. Thank you.